So in response to the claim that the law will better protect doctors from prosecution, I'm not going to dispute that. That's true. That the law, if it is enacted to allow doctors to prescribe medication so a patient can commit suicide, it will protect them more. My question is, how much protection should we really give them? I mean, we do have laws in place for malpractice lawsuits. If a doctor screws something up or there's gross negligence, you can pursue legally that doctor for damages to say, hey, he screwed up and something needs to be done about that. If we give them too much protection, as in some of these instances with the Oregon suicide law that we can actually pull up, you might be actually letting them get away with things that we shouldn't be letting them get away with. For example, according to the Oregon law, which is, there are neighbors to the north, they've had this for quite a while now, I believe since 1998, 1999, they've had it for a pretty long time. The doctor prescribing the pills for patient-assisted suicide is held only to a good faith standard, which is actually far lower than the malpractice standard applied to other health providers. So basically the standards for this are not as high as they are for malpractice, which you would think, considering they're saying that they're giving the patient the permission to go and go home and take pills essentially to commit suicide, that the standards should be just as high, if not higher, because this is such an extreme procedure. There's no mechanism to ensure that the doctors actually report or comply when the suicide is complete, because they self-report. There's no outside organization that does follow-up on this. The doctors they say, okay, according to the law, you must self-report, but there's no one sort of going after them saying, hey, you need to report on this particular prescribed suicide case that you gave. There's no one hounding them about that. Unless they do it, it's not going to happen. So some of the statistics on this stuff, we actually don't even know. And we don't know if there might have been some possible botched attempts or something like that, because the doctors aren't required to report it because if anyone's forcing them to. It's entirely up to them. And then the next thing is that there was also a specific issue, for example, with nurses, also in the Oregon, the same state. This was in the Oregon local newspaper. The quote is, "Count the sad case of Wendy Melcher as further evidence that the Oregon Nursing Board is in need of reform. Melcher's death may have been hastened 2 years ago by 2 nurses who apparently ignored provisions of Oregon's physician-assisted suicide law by administering massive doses of drugs to Melcher, a Hillsborough software engineer who was in the late stages of throat and neck cancer. The state nursing board, which is supposed to provide oversight of the nursing profession, knew about these alleged misdeeds many months ago but never told law enforcement officials. The board didn't even interview family members as part of its investigation. If nurses or anyone else are willing to go outside the law, specifically this Oregon Assisted Suicide Law, then all the protections built into the Death with Dignity Act are for naught." So there needs to be more protections actually in the case of this particular law, and that if we just say, well, we're going to give doctors all this extra protection to enact this, we have to be really, really careful with how much authority we actually give them. And when it comes to this argument for autonomy and part of that being patient choice, that's actually an interesting argument to make, but here's the problem with that. So a large portion of the country is insured. 90% of the population is actually insured as of 2015. Let's see, roughly 37% of them are on a government plan, so military, Medicare, Medicaid, something like that. So that's the one anyone can get, including if you're poor, right? So it's not a private plan, anyone can essentially get it. And that's important because that's what they have access to. That's what the general public has access to. The problem with that is that that plan has to have rationed care because they have to provide it for everybody. And that's one of the reasons why I want to bring that up, because these other countries like the Netherlands and these other places where it's legalized, they have state-run healthcare. And so for them, rationing is definitely part of the problem. Well, so for the US, we have these patients that are part of the government-run healthcare system. And in that case, we have some issues where the state-run or the government-run system basically says, yeah, it's too expensive to treat you. And we can offer you these pills to kill yourself, but even if you want treatment, we're not going to offer it to you because it's too expensive. So the cost issue, even though while it can save families money, and there's this argument for making sure that the families don't go into debt or go bankrupt or anything to treat them, well, sometimes they might want to say take that chance and go after it, but they have no choice because the government's not giving them that option anyway. It's too expensive. They're not going to cover that with the insurance. So that's not really a choice necessarily if your options are you're going to die a slow, painful death without treatment or you're going to kill yourself. That's not really much of a choice. One particular example, there were 2 examples from Oregon also. Back in 2008, there's a quote from a news article from Fox's news website in Oregon. The news from Barbara Wagner's doctor was bad, but the rejection letter from her insurance company was crushing. The 64-year-old Oregon woman, whose lung cancer had been in remission, learned the disease had returned and would likely kill her. Her last hope was a $4,000 a month drug that her doctor prescribed for her called Tarceva, but the insurance company refused to pay. What the Oregon Health Plan did agree to cover, however, were drugs for a physician-assisted death. Those drugs would cost about $50. So the cost doesn't necessarily benefit the patient to say, well, they can commit suicide and that's cheaper and that'll help the family out. If anything, that just pushes them more to commit suicide even when they might not want to. And there was a second example from there too, from ABC News, another Oregon case from 2008. Since the spread of his prostate cancer, 53-year-old Randy Stroop of Dexter, Oregon has been in a fight for his life. Uninsured and unable to pay for expensive chemotherapy, he applied to Oregon's state-run health plan for help. Lane Individual Practice Association, or LIPA, which administers the Oregon Health Plan in Lane County, responded to Stroop's request with a letter saying that the state would not cover Stroop's pricey treatment, but would pay for the cost of physician-assisted suicide. Both of these cases involved a state-run healthcare system which has to ration care to a certain extent. So you might think the private system would be better, right? Not necessarily, because rationing takes on a different form. There's a deadly mix when you combine our broken, profit-driven healthcare system with legalizing assisted suicide, says Marilyn Golden, a senior policy analyst with the Disability Rights Education and Defense Fund. The cost of dying, according to CBS News in November 2009, was, it said that Medicare, so a state-run system, paid $50 billion just for doctor and hospital bills during the last 2 months of patients' lives, those last 2 months of treatment. That's more than the budget of the Department of Homeland Security and the Department of Education. So that's huge. And if the expenses are that much, so I'm using the government because we have access to that information. We don't have access to the private healthcare insurance's costs necessarily because they're private. We don't get to see it. If it costs this much and we can see this, we can only imagine what it's like when the company's concern is the profit bottom line and not the public good, which is what the government is supposed to do.